Hi everyone, today I'll be demonstrating how to properly measure blood pressure using manual sphygmomanometer and the stethoscope. So before we begin, let's briefly understand what blood pressure is. Blood pressure is the force exerted by circulating blood on the walls of the arteries. It's recorded as two numbers, systolic pressure and diastolic pressure. The systolic pressure represents the force when the heart contracts, and the diastolic pressure represents the force when the heart relaxes between beats. Accurate blood pressure measurement is essential in assessing a person's cardiovascular health. Now let's start by looking at the equipment we'll need. This is a stethoscope, this is the cuff, this is the latex bulb, and this is the sphygmomanometer.
To measure blood pressure manually, we'll need two main instruments. A sphygmomanometer, this includes the inflatable cuff, the pressure gauge, and the inflation bulb with a valve. Opening a valve releases the air and decreases the pressure. This is a stethoscope. It is used to listen to the cough sound that indicate blood flow. Before starting, both the patient and the equipment must be properly prepared. The patient should sit comfortably with their back supported. They should rest for at least 5 minutes before the measurement, and their feet should be flat on the floor. Have their hands supported at heart level with the palm facing upward. Remove any tight sleeves or clothing that could constrict the arm, and if it is constricted, you can roll up your sleeve. Avoid caffeine, smoking, or exercise for about 30 minutes before the procedure. Proper preparation ensures an accurate and reliable reading. Next, we'll move on to the actual measurement.
Now, I'll begin with the palpatory method of measuring blood pressure. This method helps us estimate the systolic pressure by feeling the pulse, and is often done before the auscultatory method to avoid underinflating or overinflating the cuff. First, I'll ask the patient to sit comfortably with their arms supported at heart level and palm facing upward. I'll wrap the cuff snugly around the upper arm, about 2 to 3 centimeters above the elbow crease. Next, I'll palpate the radial artery at the wrist using my index and middle fingers. Then, I'll close the valve and inflate the cuff while continuing to feel for the pulse. As I inflate, the pulse will eventually disappear. This is the point where the cuff pressure exceeds the systolic pressure. Now, I'll slowly release the valve to deflate the cuff. The moment the pulse reappears is the estimated systolic pressure. The palpatory method does not provide diastolic pressure, but it's very useful for estimating where to start inflating during the auscultatory method. Next, I'll demonstrate the auscultatory method, which gives both systolic and diastolic readings. In the auscultatory method, we'll use a stethoscope to listen to the cough sounds, which help determine both the systolic and diastolic pressures. Again, I'll ensure the cuff is properly wrapped around the arm, about 2 to 3 centimeters above the N2 cubital fossa. Now, I'll place the diaphragm of the stethoscope directly over the brachial artery at the elbow crease. I'll close the valve and inflate the cuff to about 30 mmHg above the estimated systolic pressure that we got in the previous palpatory method. Next, I'll slowly release the air at a rate of 2 to 3 mmHg per second while carefully listening through the stethoscope. The first tapping sound I hear, known as the first cough sounds, indicates the systolic pressure. As I continue to deflate, the sounds will change in character and eventually disappear. The disappearance of the sound marks the diastolic pressure. Finally, I'll fully deflate the cuff, remove it gently, and record the measurement. That completes both the palpatory and auscultatory methods of measuring blood pressure.